So, I want you to imagine a patient. Let's just say she's a 61-year-old woman, right? And she's been navigating various health issues for, gosh, like nearly a decade at this point.
Yeah, which is pretty common, honestly.
Right. But by the time she finally reaches her surgeon for a major procedure, she hasn't just been, prepped for an operation. Operationally speaking, she's basically been split into four completely different people.
It's a profound fragmentation.
Yeah.
And I mean, the crazy part is it happens so quietly in waiting rooms and medical offices that we've just accepted it as the normal way healthcare operates.
Exactly. Like to her primary care provider, she's a familiar face, right? She's
Mhm.
a diabetic with a failing heart. They've managed her across 9 years, but only in 15-minute increments.
Right, keeping her story together, mostly through just the sheer force of the doctor's memory.
Yeah. But then you walk her over to her cardiologist's suite, and she isn't that person at all anymore. To them, she's just, an ejection fraction of 35%.
Meaning her heart is barely pumping enough blood to even keep her going.
Right. Along with this sprawling list of medications, and get this, two of which she quietly stopped taking months ago.
Oh, wow. The erasure of her actual identity, it really only accelerates from there because to the billing department, she is stripped of her humanity entirely.
Oh, for sure.
She becomes literally nothing but a date of service and a CPT code, just a 5-digit number they use to squeeze her entire existence into a billable invoice.
A transaction. It's just a transaction. And finally, to the surgeon who is, about to take her into the operating room, she is simply an anesthetic risk. Just a name at the top of a consent form.
4 different professionals, 4 completely different versions of the exact same woman.
It's wild. Well, welcome to today's deep dive. We are looking at this radical new blueprint proposed by Dr. Franco Pelka in this fascinating address to his fellow surgeons.
Yeah, it's a really eye-opening piece of work.
It is. And this isn't just about why the medical system feels broken, right? It's a real look at how current business models basically force doctors to treat patients as isolated problems.
Exactly. And we're going to explore Dr. Opelka's architectural solution for this, a new way to digitally represent patients, a way to rescue that 61-year-old woman from being fragmented and instead encircle her with actual care.
So whether you work in a hospital or you build healthcare tech, or honestly, if you've just sat on an exam table in a paper gown feeling like a walking collection of symptoms, this is going to fundamentally change how you view modern medicine.
Definitely. But to understand the solution, we really have to isolate the root cause of this fragmentation first. We have to look at the basic unit of time in modern medicine, which is the encounter.
Right, the encounter, that standard, 15-minute window you get with a doctor?
Yeah, that 15 minutes. And the fundamental architectural flaw of the encounter is that it has absolutely zero memory.
Zero memory. So every single time you walk into a clinic, the system effectively just starts from scratch.
Exactly. Because the encounter itself lacks memory, doctors are forced to perform what Dr. Opelka calls heroic reconstruction.
Heroic reconstruction. Man, let's picture what that heroism actually looks like on the ground. Like a physician is sitting at a computer terminal, right?
Uh-huh.
Staring at this massive disorganized file. Maybe it's a 300-page PDF of scanned faxes, messy clinical notes, fragmented lab values from 3 different hospital networks.
Oh, yeah, it's a total mess. And they have, what, about 4 minutes to synthesize all of this before they walk into the exam room.
Right. In those few minutes, they have to heroically reconstruct enough of a mental framework of who you are just to act safely.
They have to spot the thing the chart didn't explicitly say.
Yeah.
I mean, they are burning immense cognitive energy, just fighting to keep you from becoming another business transaction.
And the psychological toll of that on the physician has to be staggering, right?
Oh, it is. It's a major driver of clinical burnout today. But there is a massive hidden cost to the patient as well.
Which is what...
Well, this heroic reconstruction is literally the most expensive thing doctors do with their attention. Every single minute a surgeon or a physician spends rebuilding you from data scraps is a minute they are forced to steal away from you.
Oh, man. So it's time they cannot spend discussing your actual fears or, your expectations.
Right. Or what specific lifestyle you're trying to maintain after the surgery.
Yeah.
That conversation just gets completely lost.
But wait, let me push back a little here, just trying to square this with my own experiences.
Sure. Go ahead.
Because when I go to a specialist and they seem laser focused only on my left knee or my thyroid, it often feels really dismissive as a patient. Does this mean specialists are willfully ignoring the big picture? Do they just want to execute their procedure and move on?
I mean, it is entirely understandable why it feels that way to you or to any patient.
Yeah.
But Dr. Opelka makes a really vital distinction here.
Okay, what's that?
Physicians are actually explicitly taught in medical school to see the entire patient.
Hmm.
They are trained to consider all the intersecting, overlapping conditions that influence care.
Oh, so they do know they're supposed to look at everything.
Yes, the issue is that modern medicine has made patients incredibly complex, and simultaneously, these physicians are trapped in a business model that forces them to focus strictly on one isolated aspect of care.
Ah, I see. So it is an operational design failure, not a lack of devotion from the doctors.
Exactly. The system simply doesn't pay them to look at the whole person. It pays them for the encounter.
Because it all comes down to the underlying business architecture, right?
Right.
The economic engine of healthcare.
Right. The entire engine was built to recognize one thing and one thing only, the billable episode.
The event that triggers the invoice, like the surgery, the scan, or that 15-minute consultation.
Yep. And because the billable episode is the foundation of the architecture, it becomes the only thing that officially counts in the system's eyes.
Wow. So everything outside of that specific episode goes entirely unheld. No one owns it.
Nobody. And what's truly fascinating here is that every massive force in healthcare pushes this exact same dynamic, even when those forces are actively at war with one another.
Oh, you see this in the friction between the hospitals and the insurance companies, don't you?
Oh, absolutely.
Because health systems, they want volume. They need more billable episodes just to keep the lights on and the doors open.
Exactly. And on the opposing side, you have the payers, right? The health plans. Their entire mandate is to control costs, so they want fewer, highly scrutinized, more appropriate episodes.
But despite being locked in this constant multi-billion-dollar tug of war, they are both still only arguing about the receipt. They're arguing over the episode.
Right. Neither side is actually designing a system for the patient who has to, actually live their life outside of that single transaction.
Which is why Dr. Opelka argues that health plans and electronic health record vendors, the EHRs, have actually built some incredible digital instruments, right?
Yeah, they've built brilliant business enterprise tools. But the problem is, those tools fall wildly short when it comes to patient-driven, goal-directed care.
They basically built a financial tracking system and just slapped the label healthcare system on it.
That's a great way to put it.
You know, it makes me think of the healthcare system as this, totally unpredictable, chaotic ocean.
Oh, I like that analogy. Tell me more.
Well, underneath every supposedly stable patient is this swirling, dangerous substrate of initial conditions, right? You have social dynamics, economic struggles, like can they even afford the medication they were prescribed?
Right, plus exhausted care teams, incompatible software systems.
Exactly. Chaos is the baseline. And great care isn't about draining that ocean, because you obviously can't do that. What these brilliant doctors do is build tiny, temporary islands of order.
Islands of order, yeah.
Like a strict protocol, a surgical checklist, a perfectly clean handoff between nurses. That's an island.
That is a phenomenal way to visualize it. The doctors are basically constructing these fleeting sanctuaries of safety.
But the tragedy of the design is that the patient doesn't get to live on the island.
No, they don't.
After that 15-minute encounter ends, they are shoved right back into the open, dangerous water between these islands. And every time they reach a new shore, a new specialist, they have to completely rebuild their story from scratch.
Because the new island has absolutely no memory of the last one they stood on.
Exactly.
And that treacherous open water is exactly where the systemic failure happens. It's where patients like our 61-year-old woman slip through the cracks.
Right.
To fix this, Dr. Opelka says we can't just tweak the billing codes. We have to fundamentally transform both the business model and the digital construct.
To actually realize patients and their whole health. Because patients are encircled by their health, not just stacked up as a list of problems.
Right. And that requires a completely new architecture. Which brings us to Dr. Opelka's proposed structural solution, the circle of arcs.
The circle of arcs. Okay, so this requires completely changing the geometry of how we view a patient's chart, right?
Yeah, he introduces a model of containment. But it's crucial to understand that this is never a ladder to be climbed. It's not some hierarchy where one thing is more important than another.
It's more like layered compartments, right? Concentric circles.
Yes, exactly.
So at the most granular level, you have the encounters, those 15-minute visits. And encounters are contained within Episodes.
Right. So the surgery, the immediate pre-op blood work, the post-op recovery, all of that makes up a single episode.
Okay, now widen the lens again. Episodes are contained within care journeys. And what makes his vision so radical here is that a care journey has a beginning and an end defined entirely by the patient.
Yes. Not the hospital's discharge criteria.
Wow, that's a huge shift.
It is. The metric of success becomes, did the patient get back the life they were trying to keep? Did they regain enough mobility to walk their daughter down the aisle? That is the end of the care journey.
That's beautiful, honestly. And widening out one final time, care journeys comprise an arc.
Right. An arc is an entire clinical domain or service line. So if a patient has diabetes, everything related to that is contained in their metabolic arc.
And their heart failure is their cardiac arc.
Exactly. And this is where the geometric shift becomes literally life-saving. Because in the current system, a patient's chart is just a vertical list of problems tucked in a digital folder somewhere.
Right, a very disconnected list.
But in this new architecture, these arcs encircle the patient. The patient sits permanently in the center, and all of their arcs wing around them in a continuous circle, all open, all active, simultaneously.
And at the center of the circle, holding the entire construct together, is the primary care physician, right?
Yes.
And then on the outer concentric rings, each owning and managing a specific domain, are the specialists, like the surgeons.
That's the blueprint.
Wait, hold on, though. I'm trying to picture this in a practical setting. If we just reorganize a patient's problem list into a circle, aren't we kind of just rearranging the deck chairs on the Titanic?
How do you mean?
Well, if I'm bleeding out on a surgical table, or I'm in a critical care situation, the geometric shape of my digital file seems totally irrelevant. Like, why does a circle actually matter?
Okay, I hear you. But it matters because a vertical list implies isolated, stacked problems that can be managed independently by different experts who never need to speak to one another.
Okay.
A circle structurally forces the system to see the intersecting concurrent realities of the patient's whole life at all times. Let's look at a concrete example from the source material.
Sure, let's hear it.
Suppose you have a diabetic patient. That is an active metabolic arc. They also suffer from congestive heart failure. That's an active cardiac arc. And suddenly, they are diagnosed with a malignancy, an oncologic arc.
Oh, wow. So they need aggressive cancer treatment immediately.
Right. And that cancer treatment requires a course of chemotherapy that is known to be both nephrotoxic, so highly damaging to the kidneys, and cardiotoxic, damaging to the heart.
Okay, that sounds incredibly risky.
It is. Now, if you are operating on a traditional problem list, the oncologist treats the cancer, the cardiologist manages the heart, and the endocrinologist adjusts the insulin, all in total isolation.
Oh, geez, so the patient is left swimming in that dangerous open water between them.
Exactly. Relying on one of those doctors to heroically reconstruct the dangers of these overlapping treatments during a 15-minute visit.
Which we already know they don't have time to do.
Right. But in a system built on a circle of arcs, the moment any provider opens the record, the entire construct is visible. The oncologist can see perfectly and immediately how their proposed chemotherapy interacts with the active cardiac and metabolic arcs.
Because they are all part of the same continuous loop, that makes so much sense.
Yeah, it forces visibility.
But, I mean, visualizing this on a whiteboard is one thing. Actually building this across competing clinics, rival hospital networks, and a dozen different specialists, that requires a digital engine that simply does not exist in most modern healthcare settings.
No, it doesn't. And that's the hurdle. We have to talk about the digital machinery required to pull this off.
Yeah, and I think we have to address the anxiety that always bubbles up when we talk about massive digital transformation in medicine. People hear algorithms and automation and assume, a robot is being designed to take the surgeon's scalpel.
Oh, absolutely. But Dr. Obelka is very quick to disarm that fear. No machine is coming for human judgment.
Right.
An algorithm cannot feel a plane of tissue during a complex surgery. It cannot make a split-second ethical decision in a chaotic operating room. The judgment, the craft, and the art of the physician are completely secure.
So what's the goal of the tech then?
The goal is simply to give doctors back the cognitive space they've been denied for 30 years. He calls this the digital interoperability wizard.
The digital interoperability wizard. Okay, I love that. And it relies on two vital concepts, right? Semantics and ontology.
Correct.
So if semantics is essentially just getting all the different computer systems to agree on a standardized language.
Yes, exactly.
Like knowing that when a primary care doctor writes MI in a chart and a hospital discharge summary says myocardial infarction, and a patient simply says they had a heart attack, Semantics ensures the digital wizard knows, unambiguously, that all three of those things are the exact same event.
Spot on. It creates shared meaning out of messy human data.
Okay. Which means ontology must be the layer that connects those dots. It's the shared structure.
Right.
It tells the system how that heart attack actually impacts the patient's upcoming surgery, or how it relates to a specific blood thinner they are taking.
It makes the relationships between the data points highly legible to the provider.
It's essentially sheet music. Think about it.
Sheet music.
Yeah, you've got a brilliant violinist and a world-class cellist who have never actually met each other. Semantics and ontology are the musical notation. It's the universal language that allows these soloists to sit down and play a complex symphony perfectly in time without ever having to speak.
Oh, that is a fantastic way to look at it.
The EHR, the machine, it doesn't play the instrument, it just makes the score legible so the surgeon can conduct their part without hitting a wrong note.
Exactly. The notation allows meaning to move cleanly across every seam of care. Without it, a human being has to manually retype or reconstruct the story every single time the patient moves to a new clinic.
And every time a human has to manually rebuild that story, a little bit of the patient's truth is lost in the translation.
Exactly right.
So we have the new architecture, the Circle of Arcs, and we have the digital score, the interoperability wizard handling semantics and ontology. What is the ultimate payoff of all this? Like, how does this actually change the day-to-day reality of a doctor and the outcome for a patient?
Well, it fundamentally changes how we define proof in medicine, and it returns the single most valuable resource a doctor has, which is their attention.
Okay.
Currently, the system cares about three proofs of value. Proof of service, was the care physically delivered? Proof of safety, did we avoid catastrophic harm? And proof of benefit, did the patient actually reach their goal?
And the major criticism of the current transactional system is that we are, decent at measuring cost and harm, but terrible at measuring actual benefit to the patient's life.
Exactly. Dr. Opelka points out that our failure to measure benefit stems from grading patients on a population average curve.
Meaning what, exactly?
The system looks at what the average 61-year-old with a 35% ejection fraction tends to do after a specific surgery. But our patient isn't the average. She is a specific, unique individual with a highly specific set of intersecting arcs.
Right. So grading her success against a baseline that was never hers to begin with makes absolutely no sense.
None. But this new digital engine completely changes that dynamic. It utilizes predictive analytics and Monte Carlo simulations to create a risk-adjusted baseline built specifically for her.
Okay, let's make sure we understand that mechanism. A Monte Carlo simulation is essentially running thousands of possible scenarios based on random sampling, right?
Yep, that's it.
Like a highly advanced weather forecast. You wouldn't want a weather forecast that averages the climate of the entire country. You want the forecast for your specific zip code.
Exactly the right framing. The engine runs 10,000 simulated surgical outcomes using her specific modulated variables. It factors in her 35% ejection fraction, her kidney function, her specific clinical burden, even her social reality.
Wow.
And it recomputes this unique, hyper-personalized baseline every single time a new episode opens.
That is incredible. So when we ask for proof of benefit, we aren't asking if she matched the national average. We're asking, did this surgical episode move her toward the specific life she was trying to keep relative to where she actually started?
Yes. Which brings us back to the ultimate payoff story from Dr. Opelka's address. It circles all the way back to our 61-year-old patient, a woman who had been split into 4 different people.
Right, our patient from the beginning.
Somewhere during her 9 long years of managing heart failure and diabetes, her depression came back. And she quietly stopped taking the medication that was keeping the dark away.
Because she was overwhelmed.
Exactly. But not a single one of her 4 world-class doctors ever asked her about it.
And we know now that it wasn't because they didn't care. It was because asking about her depression wasn't anyone's billable episode.
Right.
It wasn't the surgeon's procedure to bill for, and it wasn't the cardiologist's purview. Her mental health was completely lost in the open water between their islands of care.
Exactly. But when you place that same patient inside a circle of arcs, there is no open water. Her mental health is a behavioral arc. It's a real structural dimension with a permanent place on her ring, deeply connected to every other episode she experiences.
Because stopping a heavy psychiatric medication absolutely affects her anesthetic risk, her heart health, and her physical ability to recover from surgery.
Yes. In this new architecture, the digital engine does the brutal, exhausting work of scanning that 300-page PDF. It finds the needle in the haystack automatically.
Wow.
It notices the lapsed prescription and recomputes her wrist fingerprint on the morning of her operation.
Which means the surgeon doesn't have to spend their precious 15-minute encounter acting as a, heroic data entry clerk desperately trying to reconstruct her timeline.
Right. When the machine takes over the burden of data assembly, the doctor gets their attention back. And with that returned attention, the surgeon looks at the circle of arcs, spots the active behavioral arc, and finally asks the deeply human question that saves the patient's quality of life.
That gives me chills, honestly.
The surgeon doesn't ask because an algorithm beeped and ordered them to. They ask because a human physician finally had the cognitive space and the attention to spare, and they recognized that the whole patient was theirs to hold.
Think about what this means for you, the listener. The next time you are sitting in that freezing room in a paper gown, instead of spending your 15 minutes frantically repeating your medical history to a doctor who's aggressively typing into a monitor, your doctor already has your story assembled.
Yeah, they can actually spend those minutes looking you in the eye.
They can ask you what you are truly afraid of, what risks you're willing to take, and what kind of life you are fighting to get back to.
It is the ultimate shift from a fragmented transactional system to a seamless, patient-centered architecture. It proves that technology, when applied correctly, doesn't distance us from our doctors. It encircles us with care, and it gives physicians their humanity back.
We've covered some incredible ground today. We started by examining a system that fractures a person into billing codes and isolated episodes, forcing exhausted doctors to build islands of order in an ocean of chaos.
Yep.
And we've seen how shifting to a circle of arcs powered by a digital score that shares meaning without replacing human judgment can finally allow the healthcare system to see us as whole people again.
It's a powerful reminder that the business models and the digital tools must always serve the care, not the other way around.
Absolutely. But I want to leave you with a final thought to mull over. If the future of healthcare is shifting from managing isolated episodes to encircling us with interconnected arcs, how might that change how we view our own daily lives?
Oh, that's an interesting question.
Think about it. Instead of treating our diet, our mental health, our stress levels, and our physical fitness as separate, isolated episodes to be fixed one by one, what if we started managing our own lives as a circle of arcs? What happens when we realize that every single choice we make is deeply connected to the center, which is the life we are ultimately trying to keep?
It completely changes the paradigm of personal health.
It really does. Until next time, keep diving deep.